Majesteit, excellenties, geëerde genodigden.
Majesté, it is my honor and it is my pleasure to welcome you today on behalf of the Royal Academy of Medicine here in the Palace of the Academy. Majesty, back in 2019, Your Majesty followed the traces of Fabiola and Paola and accepted to act as a protector of both medical academies. You confirmed and both renewed the tradition, and you also made it stronger. It is part of our tradition to organize symposiums whose format and shapes are decided with you. And this is part of the new mission of our academies. We also advise and give advice on medicine. This is the first symposium of Your Majesty, and this is the outcome of many years of preparation. We are grateful for your active commitment, your input in terms of content, and your stimulating questions that were used as a thread line. Dear guests, colleagues, Majesty, Your Majesty, you have chosen the mental health of children and adolescents as the topic of this first symposium. It is a subject which is very dear to you. It is indeed a very complex topic that affects the whole of society as well as the future of society. Mental health disorders among children and adolescents have long-term effects as mental disorders disrupt the life of those who are affected by it, and it also affects the whole of society. In the meantime, we have the necessary means to take up these challenges if we are ready to take up such challenges. This first symposium was organized in close cooperation with Her Majesty, and it is also organized under your leadership. Our approach is based on scientific evidence as well as experts and stakeholders consultation, and we've also been working in close cooperation with young people. We are very dear to having those young people with us today, and it is now time, Majesty, to give you the floor for the first speech of our morning session. Good morning. First of all, I'd like to say that young people testimonies were so exciting that I didn't watch the clock. And I would like to apologize for arriving late. I didn't get the time to look at my watch as I was focused on the young people's testimony. So please accept my apologies for the delay. Ladies and gentlemen, mental health is key if we are to develop the life of each and every one of us. It is a key component of the general health as stated by the WHS. The WHS has defined mental health as a state of well-being that allow each person to fulfill their life, to accomplish personal prospects, and to be part of society, and to bring valuable input to society. There is no health, no well-being without a good mental health. This is part of the WHO statement, and it shows to which extent mental health acts as a protection against psychological and psychiatric disorders. We do know that children and adolescents are vulnerable to psychiatric sufferings. The prevalence of mental disorders among children and adolescents is constantly increasing. For those aged less than 18 years old, this prevalence amounts to 20%. It is more than diabetes and AIDS for the same age category. 85% of these young people need professional health care, and very often these professional health care are not accessible. However, we do lack data in order to give an exhaustive framework of the situation in our country and to adjust the health care offer. The COVID crisis, the various lockdowns, as well as domestic violence have affected young people, their development and their self-sufficiency, as well as their mental health. Services are overburdened, waiting lists are very long, which has made it very difficult for young people to find the necessary support. The call for assistance and the numerous attempts of suicides or self-mutilations, food disorders, mental anorexia, as well as risky behaviors are more numerous today than they were in the past. 75% of mental health disorders emerged before the age of 25 years old. These disorders that appear during childhood and are associated with addictions lead to a decline of 25 years of life expectancy for those affected by mental health disorders. There are two periods in life that require special attention. The first 1,000 days, and then the teenage years and the transition to adulthood. These are two key periods during which the social factors, the family factors play a key role in the brain development of the young adult or the adolescent. Ladies and gentlemen, we are not born with the same opportunities. However, we should all benefit from benevolence, attention, and care if we need it. In our country, it is quite easy to get a medical appointment for a fracture, an appendicitis, or other general disorders. But why is it that one feels so ashamed to ask for help when he's in psychological difficulties, when he or she feels alone, isolated, or anxious and overwhelmed by anxiety? Why is it that psychological disorders are seen as a taboo or a weakness? When faced with mental health disorders, we need a change of attitude. I think that the whole of society should give a new look and to the difficulties of young people, to make access to healthcare easier. Together, we should develop a culture whereby it would be normal to express one's emotions and one's feelings, and if need be, to ask for help. Psychological and physical sufferings are should be treated on an equal footing, and vulnerability should be considered in one sense as a strength. Preventing mental health disorders in children and adolescents is fundamental. The effects of extended stress on the brain development associated with life difficulties will have an impact throughout the life cycle of the person and will have an impact on its mental health, as well as the immunity, biological, heart, endocrine, and metabolic system. Scientific evidence shows that prevention can reduce the risk and of many physical and psychological sufferings, included for adults, nervous breakdowns, anxious disorders, attempts of suicides, delinquency, and heart diseases can be prevented if we are able to diagnose these mental disorders while taking into account many parameters: intellectual, emotional, relational, environmental, social, and economic, as well as cultural and intellectual. Primary prevention as well as early diagnosis of risk factors are key if we are to take the right measures that will guarantee the well-being of children and their parents on the long term. They are key in guaranteeing the proper inclusion of young people within society. A child who is self-confident will be a better balanced child for himself and for his family. A child that has the right follow-up will be prevented from other diseases that emerge at a later stage. So it is ideal to offer the same type of program as of the age of as of pregnancy and early childhood. But how can we diagnose the early signs of a psychological disorder, and how can we offer the right help to families facing psychological and social difficulties? I think that throughout our society, every sector should take the right commitment to prevent psychological and social disorders. Psychological vulnerability among parents can also generate greater stress for parents and children. A child that cries, that has eating disorders, that has behavior disorders, that does not sleep well at night. Well, very often for children, these disorders are related to a psychic well-being disorder. Mental negligence during the first 6 months of life usually lead to, for half of the children aged less than 3 years old, lead very often to psychological and social behaviors, as well as behavior disorders. The child will become more violent and will tend to be excluded from society. So we should make sure that every child has access to assistance to avoid school dropout and to avoid being setting aside from society. Every child, every teenager should benefit from professional assistance, an assistance that is, of course, a quality assistance focused on their needs and given within their life environment. We need to do even more and to advance even more to make sure that parents are included within the care trajectory given to children. Now, mental health care does not always allow for the parents to be included in the care pathway, in the care trajectory, but the All families should be included within this trajectory. Supporting children and adolescents is not something which is being done globally. Somatic and psychic healthcare are very often offered separately. A social, psychological, biological healthcare pathway is key. During childhood, body and mind are closely intertwined. Emotional problems can accompany physical disorders. This integrated healthcare pathway must be based on a participatory approach that will take into account the life cycle of the child or the adolescent. And the child or adolescent should be proposed the right treatment. Being included within society strengthen the capacities of children and adolescents when it comes to problem solving, communication problem solving, identity problem solving, including them within their mental health care pathway, including them when they face difficulties, will contribute to destigmatize these children and teenagers. The participatory approach help the children and teenagers to acquire new responsibilities individually and collectively. And at the end of the day, these young people will feel less different, less alone, and less at loss. Young people need assistance at school that can be compared to those that are offered in secondary school. Young people need to share their views, their feelings, need to communicate about their weak points, their and need to see how they can turn these weaknesses into strength. They're also eager to talk about their wishes, their future, their objectives. They are eager to develop relations based on trust. They're also eager to access information more easily and to access information about the assistance that they could benefit from and the healthcare or listening help they could benefit from. Involving teenagers and children within the healthcare pathway requires a new type of focus. Young people do not want to be talked of. They want to be talked with. They want to be part of the conversation. And this is why the program of today's symposium was designed in close cooperation with young people. We need to acknowledge the strength and the talents of these young people. We must help them fulfill their dreams and their projects. We must help them develop their skills to help them become stronger and more resilient. We must focus even more on the participatory approach and listen to the parents, the relatives. This is the case for healthcare, for leisure, and for private life. Investing in mental health care for children and adolescents involve investments in prevention and in physical and mental health prevention. In 2015, mental health care for children and adolescents underwent reforms. Many initiatives were taken, many projects were launched. These projects have shown their added value. They must now be pursued to meet the needs and wishes of teenagers and adolescents. We have to pursue the work to include all the sectors, and these sectors go beyond the healthcare sector, the education sector, the well-being of families, leisure activities, extracurricular activities that contribute to the well-being of children and adolescents. Training for all, training for anyone that is in close contact with children and adolescents is also key. We need to respect each and every one of the member of societies, taking into account their need for prevention, early diagnosis of mental and physical suffering as members of families, as friends, as teachers, as social workers, educators, coaches. I think that we must pay close attention to children and adolescents. We must listen to them, respect them, support them, and if need be, we should also offer them the right care, the care that they need. The Royal Academy of Medicine here in Belgium can give a new impetus to scientific projects around mental health and support these projects so that prevention, early diagnosis, and evidence-based treatment can be further improved. Society as a whole need to ponder the space that it is ready to give into children and adolescents and the role that they can play in developing the measures that they rightfully need. Thank you very much for your attention.